From a dietary standpoint, of course, it is just trying to lower the saturated fats in the diet if you can. If you're diabetic, of course, trying to adhere to the Diabetic Association diets, extremely important. Uncontrolled diabetes is such a large risk factor for promotion of vascular disease, actually more prominent in women than men in this regard as far as having effects on the coronary arteries. And so having good diabetic controls is very, very important. Trying to really push yourself to stay away from the tobacco use, which is such an easy thing to say and not always easy to do for so many people, but that is critical for vasculature to stay healthy. Really paying attention to your blood pressure and remembering that even if you don't have diagnosed blood pressure now, it is an aging process that once we get to a certain age, the prevalence of hypertension is extremely high. And so even though we may not have it in our 50s, in our 60s, we may show signs of early hypertension. And trying to keep on top of that and paying attention and treating it appropriately, very important. So good diets, just a healthy activity pattern, keeping the steps up in your day and doing the best you can with that. And again, seeing a primary provider and making sure all of these important risk factors are looked at and kept, monitored closely is very, very important.